Hi, I'm Dr. Sheila Reyes from the Philippines, reporting virtually for Room Now at the ACR 2023. I would like to talk about HPV vaccination and cervical cancer screening in rheumatic disease. Last year, the ACR came out with updated guidelines on vaccination. The ACIP recommends HPV vaccination for individuals aged 11 to 26 years old. For those aged 26 to 45 years, particularly those SLE and RA patients or those with rheumatic disease who have not been previously vaccinated, the ACIP recommends HPV vaccination based on shared decision making. Which brings me to discuss abstract number 1356 by the group of Dr. Amaya Small on the reproductive history and HPV vaccination awareness among women with SLE and RA. Their study is an interim analysis of their rheumatology women's reproductive health and wellness cohort, in whom participants responded to questions on rheumatology history, reproductive history, and HPV vaccination awareness. The group then compared reproductive history and HPV vaccination status and awareness among their patients with SLE and RA included in the cohort. Now, both groups were similarly likely to be sexually active with similar reporting times since their most recent pap smears, as well as abnormal pap smear results. But SLE patients were reported to have persistently abnormal pap smear results on follow up than RA patients. And in addition, cervical cancer screening discussions by rheumatologists were done more on SLE than RA patients. Both groups were also similar in terms of HPV vaccination awareness and HPV vaccination status. However, 50% of the cohort members who were or are eligible for vaccination, these are respondents less than 45 years old, did not receive the HPV vaccine. The major reason reported was simply because they were not offered the vaccine. Other reasons included they did not know it was important, and they were concerned of the vaccine side effects. Studies such as these make us realize the daunting role we rheumatologists have to play in the management of our patients. It opens our eyes to the reality that despite the evidence and recommendations, HPV vaccination rates are still low. And I think that is um, a global finding. So that being said, this interim analysis highlights the importance of increasing HPV disease awareness and discussing vaccination and cervical cancer screening with our SLE and RA patients. Follow me on X at Rumarapa and tune into Room Now for more reports and videos of the ACR Convergence 2023. Thank you.